Hi guys, welcome back to my channel. I am changing things up a little this time and I'm starting a frequently asked question series where I am collecting all the questions that I have heard in the past from parents, the most frequently asked questions, and I'm going to make quick videos on it answering these questions for you. So if you are wondering some things and if you want to ask something to your speech therapist, comment below in this video and I will answer it. Okay. So the first question we're going to see today is, when should I start speech therapy for my child? Okay, so you might have wondered this in the past, or you're right now thinking about this. Should I start speech therapy for my child? Should I wait? Should I put him in school? Should I give him this medicine? What should I do? Right? So when should I start? Today I'm going to answer this. So I'm giving you 4 age ranges and you're going to tell me which is the age you think is right to start speech therapy. Think. I'm going to wait 5 seconds. Okay, now you have an answer in mind. Okay, so keep the answer and let's compare it with the next slide where I give you the answer. Okay, before I go to the next slide, if you've already started speech therapy for your child, comment below this video and tell me when you started speech therapy, because I want to know when you started speech therapy for your child. Okay, so the answer finally is to start as early as possible. So if you're thinking in this from the previous slide, should I have started at 1.5? Should I have started at 2? Oh no, I waited till 3. If you're thinking like that, then please stop thinking like that, because it's not going to help your child right now. And I'm sure even if you started at when you were 3, you helped your child as much as possible. So let's keep going, right? Don't feel guilty about it. At 1.5, it's quite difficult to start actually, because developmental trajectories or the course of development for each child is a bit different. So as a parent or even as a professional, it's very difficult to identify if a child really has a delay or if it's just a developmental difference or what. But yes, now we have come very far. Now we have a lot of tests, a lot of behavioral tests, psychological test batteries that we can use to identify. So yes, start as early as possible. Now this early as possible can vary because it is in reference. So when I say early as possible, it is in reference to when you first identify that your child might have a delay. So you might have identified at 1.5 or 1.8. If you say, let's assume that you identified at 1.8 and you should start immediately, or within a month, start immediately. But don't wait for your child to develop on their own. And we have this common misconception in India that boys tend to speak later than girls, so that it's not a big deal. Although this is a trend, but if you see some kind of differences in your child, and if you are worried, just go to a speech therapist, because it is not going to hurt you. It is not going to hurt your child to go to a speech therapist and get a few sessions of therapy. Right. Now, why am I telling start as early as possible? As early as possible in reference to when you identify. So again, this is not dependent on age. So even some conditions are not very easy to diagnose, and the child can go ahead and have a typical developmental life, going to school, going to having extracurricular activities, doing sports and all this. But around 10 years of age, only they get a diagnosis. So this happens too. So even if you get a diagnosis, or even if you identify something in 10 years of age, go immediately for intervention services. Like whenever you get a doubt, start there. Find a therapist, find somebody who's not too expensive, find somebody who's nearby, who's accessible to you. And at this time, even teletherapy is working very well for many families. So find somebody and start. Now, why am I saying this? Why is this important? 3 reasons. The first reason is neuroplasticity. What I tell is, let's think about clay, right? So you might have clay at home, or if you know clay. So if you take clay and keep it outside, keep it in one corner of the shelf and just leave it like that, what happens? It hardens. Instead, if you give it water, if you play with it a little bit, if you press it a little bit, every one day or once in a week, then the clay softens, it's soft. Similarly with your child. You cannot just wait and let your child do this and figure it out for themselves, because when you identify parental concerns is one of the risk factors for a developmental disability. So if you identify it, that there's something different with your child, or there's something to think about, something to get checked, so then that is a cue that you have to start treatment, and you should not just let your child be and wait, because the skills that they don't learn in this period will set, and the gap will expand. So that brings me to my second point, which is smaller gap. So think of yourself, like if you're 65 kgs or 70 kgs and your goal weight is 60 according to your BMI, and it's only 5 to 10 kgs that you have to reduce. But if you were 75 kgs, or if you wait until you're 80 kgs, you have 10 to 15 kgs to reduce. So you have more work to do. So it is better to start early. The third reason is that communication is a very basic skill. Every human being needs it. And speech is one of the modes of communication. When a child does not have speech, then what happens is they're not able to express themselves. And because of this, they have a lot of frustration and pent up feelings that can be seen as anger and, as very loud outbursts and screaming and pushing and pulling. So all these behaviors can come up. And when the child is not given intervention, these behaviors will set as the means of communication. Even if they can't speak, an AAC should be given to the child. Even if a child can speak, an AAC should be given. So some type of means is always better to be given to a child. That is why early intervention is important. Now, there are many more reasons why early intervention is important. For that, you wait for my second video where I talk about why you should start early, apart from these 3 reasons. Okay, so I hope I answered your question. See you in the next FAQ. Bye.